The spinal nerves are 31 pairs of nerves that originate from the spinal cord, and they're basically numbered for the point of exit along the vertebral column. So if you counted them all, we would actually have 8 cervical spinal nerves, 12 thoracic, 5 lumbar, 5 sacral, and 1 coccygeal, which ends up yielding 31 pairs total. Now, the reason why we have 8 cervical spinal nerves is that the first spinal nerve exits the vertebral canal superior to the first vertebra, and it actually exits between C1 and the occipital bone. And so if you counted them down, it turns out we actually end up having 8 cervical spinal nerves rather than 7. So it doesn't correlate with the number of vertebrae there. Now the last cervical spinal nerve, C8, exits the canal inferior to C7. And so vertebra C7 has a nerve that leaves above it and one that leaves below it. The one that leaves above it is named C7 spinal nerve, and then the one that leaves below it is C8 spinal nerve. Now beyond that, all the rest of the spinal nerves are named for the vertebrae that's above. So if we look at the spinal cord here, we see that it goes down the back through the vertebral canal, and it ends right around L1. Now, if you look at along the spinal cord, all of these coming off are the spinal nerves, and they're essentially named for their point of exit along the vertebral column. So we have 8 cervical, 12 thoracic, 5 lumbar, 5 sacral, and 1 coccygeal spinal nerve. Now, the spinal nerves are formed when the ventral roots and the dorsal roots come together. If you remember going back to the spinal cord, we talked about how the ventral roots contain motor axons, and the dorsal roots contain sensory axons. And these converge to form the spinal nerve that exits through the intervertebral foramen. So you can see the dorsal root and the ventral root. And they come together here to form the spinal nerve that exits the intervertebral foramen. Now we have a dorsal root ganglion here that's associated with the dorsal root, and this actually contains primary sensory neurons that are associated with like your skin, muscles, and joints. And then we actually have these rami communicantes that we'll actually talk about in the sympathetic chain ganglia that we'll talk about in chapter 14. So the spinal nerves emerge from the vertebral column via their respective intervertebral foramen. And the spinal roots progressively become longer from superior to inferior down the cord. Now, lumbar and sacral roots are very long and extend through the lower vertebrae as cauda equina. So the spinal nerves are quite short in the cervical region, and almost immediately after exiting the foramen, they actually divide into 3 branches. We actually have the dorsal, ventral ramus, and a meningeal branch. The dorsal ramus is a small branch that goes towards the back. The ventral ramus is a larger branch that goes lateral and anteriorly, and the meningeal branch just innervates the adjacent meninges. Now we also have rami communicantes here, which contains autonomic nerve fibers that join the ventral rami, and we'll talk about these in chapter 14. So if you look at a cross-section of the thoracic wall here, we'd find, here's our thoracic cavity. We have some of the thoracic muscle near the ribs and the sternum here. And then here's the thoracic vertebra with the vertebral foramen with the spinal cord within it. You can see that the dorsal and ventral roots come together to form your spinal nerve here. And then the spinal nerve divides into the dorsal ramus, which goes to the muscles and the skin of your back, as well as the ventral ramus, which is a larger branch that continues around the lateral aspect of the thoracic wall, and to the anterior aspect, going to the muscles and skin of the rest of the trunk. Now, spinal nerve rami and their main branches supply the entire somatic region of the body from the neck down. Dorsal rami supply the posterior body trunk, which is what we saw in the last slide, and then the ventral rami supply the rest of the trunk, as well as the limbs. So the limbs only receive ventral rami branches, no dorsal rami. And the difference between the roots of the rami is that roots lie medial to form spinal nerves. Each root is only sensory or motor. So if you have damaged the dorsal root, then you're going to lose sensory function. And if you damage the ventral root, then you're going to lose motor function. And so there's actually a distribution of function there. However, once these roots come together, they form the spinal nerve that contain both sensory and motor functions. Now, all ventral rami, except for T2 through T12, form interlacing nerve networks called nerve plexuses. You find nerve plexuses in the cervical region, brachial region, lumbar, and sacral regions, and only the ventral rami form these nerve plexuses. You're going to find that there are dorsal rami, but those actually go to the skin and muscles of the posterior aspects of those regions. Now, within the plexus, fibers crisscross so that each branch contains fibers from several different spinal nerves, and fibers from the ventral ramus go to the body periphery via different roots. This means that each limb muscle is innervated by more than one spinal nerve. And this serves our body very well because if you have damage to one spinal nerve, you won't lose function of entire muscle necessarily. So this allows for some redundancy or some backup. That way, if there's slight damage in one area, you don't lose entire function of a limb. So the first nerve plexus we'll talk about is the cervical plexus. And this is adequately named for the cervical region where you find it. Now, the cervical plexus is formed by the first 4 cervical spinal nerves. They interlace to form this plexus, and then most of these branches form cutaneous nerves that go to things like the skin of your neck, ear, back of the head, and shoulders. Other branches can innervate neck muscles as well. But the major nerve that comes out of cervical plexus is called the phrenic nerve. Now, phrenic nerve contains motor and sensory nerve endings that connect with the diaphragm, so the respiratory diaphragm, and that's the major muscle for breathing. And so phrenic nerve receives fibers from C3, C4, and C5, so it contains some nerve fibers from a different plexus, but phrenic nerve is the major nerve from cervical plexus. In fact, there's a good way to remember this too, is that because phrenic nerve goes to the respiratory diaphragm, it's C3, C4, C5 staying alive. Because if you damage your spinal cord above C3, you're going to lose phrenic nerve function and you therefore won't be able to breathe, which means you won't stay alive. But if you damage your spinal cord below C3, C4, C5, then at least you can have some phrenic nerve function and at least still breathe on your own. So what this picture here shows is the cervical plexus. Remember, it's formed by the first 4 cervical spinal nerves here. And all of this is the plexus. Remember, nerve plexuses are only formed by the ventral rami of those spinal nerves. And they form this interlacing network of nerves, which is the plexus itself. Now, there's a lot of different nerves that arise from the cervical plexus. Ones like the lesser occipital nerve, greater auricular, transverse cervical, and ansa cervicalis. Now, these aren't as important for this class. But the one that we'll talk about in more detail is the phrenic nerve, which is what you can see here. And it's a pretty large nerve. Remember, phrenic nerve is actually formed by C3, C4, and C5 spinal nerves. Those branches actually converge to form phrenic nerve, which goes down the neck, lateral to the heart, and then goes right into the respiratory diaphragm to control breathing. So, this shows the cutaneous branches, which essentially go to the skin of different areas of like the head and neck and shoulder. But the motor branches include things like ansa cervicalis, which goes to some of the infrahyoid muscles of the neck for swallowing. There's other segmental and branches that go to deep muscles of the neck, also for swallowing and breathing. But the big one here, you guys, is phrenic nerve. That's formed by C3, C4, C5. This goes to the respiratory diaphragm, and it's only motor output. Now, the next nerve plexus we'll talk about is the brachial plexus, and this is actually formed by cervical spinal nerves C5, C6, C7, C8, and T1, but in some variations, in some people, it may include C4 or even T2. But for the most part, it's C5 through T1. Now, these give rise to nerves that innervate pretty much the entire upper limb and some of the muscles of your pectoral girdle. Now, there are 4 major branches of this plexus. We have roots, trunks, divisions, and cords. The roots are essentially the ventral rami that converge into trunks. These trunks, we have upper, middle, and lower trunks, which unite to form and divide into divisions. We have anterior and posterior divisions, which unite to form what we call cords. We have lateral, medial, posterior cords, which then divide into the terminal branches that go to your upper limb. So what this slide is showing is basically the brachial plexus. It's located, in the cervical region, in the superior thoracic region. These ventral rami are what we call the roots of the brachial plexus, which is confusing. This is not the roots of the spinal cord. They're the roots of the plexus, which are actually the ventral rami. Now, C4 and C5 converge, and C6 converge to form the upper trunk. C7 turns into middle trunk, and C8 and T1 turn into the lower trunk. Now these trunks have anterior and posterior divisions. All of the posterior divisions form what we call the posterior cord. The anterior divisions of the upper and middle trunks form lateral cord, and then the anterior division of the lower trunk turns into medial cord. Now these cords divide into terminal branches. So we have terminal branches like your axillary nerve, musculocutaneous nerve, radial, median, and ulnar, as well as some other smaller branches. But these are important nerves that go to the upper limb. So this is just showing a flow chart to kind of illustrate the brachial plexus in a more simplistic way. Remember, C5 through T1 ventral rami of the spinal nerves turn into the trunks, which divide into divisions. All the posterior divisions turn into posterior cord, whereas the anterior divisions of the upper and middle trunks turn into lateral cord, and then the anterior division of the lower trunk turns into medial cord. And these are showing the terminal branches. Now we'll talk about the functions of these terminal branches coming up next. So the axillary nerve, which is a terminal branch of posterior cord, innervates deltoid, teres minor, and the skin and joint capsule of the shoulder. And it's named this because it goes deep into the armpit, hence the name axillary nerve. Now, another one that comes off of the posterior cord is radial nerve, and radial nerve, which is on this slide, actually goes to all the extensor muscles and supinators and skin of the posterior limb. So when we think radial nerve function, think of all the extensors of your upper limb. Now, musculocutaneous nerve goes to biceps brachii, brachialis, coracobrachialis, and the skin of your lateral forearm. Think of this as going to the flexor muscles of your arm at the elbow and skin on the lateral part of your forearm. And the median nerve goes to skin and most of the flexors of your forearm, as well as the wrist and finger flexors and thumb. So median nerve goes to the, kind of think of like the lateral forearm flexors. Ulnar nerve goes to flexor carpi ulnaris, and part of the flexors that are on the medial aspect, think pinky side or ulnar side. And this also innervates the skin on the medial aspect of your hand, wrist, and it's involved with some finger flexion, especially the pinky and the ring finger. Now, looking at the terminal branches here, remember we see axillary nerve. Axillary nerve goes to the skin of the shoulder as well as deltoid and teres minor. We see our musculocutaneous nerve as well, which goes to biceps brachii, brachialis, and coracobrachialis, as well as the skin on the lateral aspect of your forearm, which actually makes sense based on its location. Remember the radial nerve, because it runs posteriorly, it actually goes to all of the extensors of your arm. This includes triceps brachii and all the extensors on the posterior aspect of your forearm. We have the median nerve, which goes to the lateral aspect of the forearm, and then ulnar nerve, which goes to the medial aspect of the anterior forearm. And they innervate the skin and muscles of those respective regions. Now, what this table shows is basically those terminal branches, which spinal nerves form those terminal branches, and the structures that they innervate. And we ultimately talked about this for the most part. Now, there are some smaller branches like dorsal scapular, long thoracic, subscapular, suprascapular, and pectoral. There's lateral medial pectoral nerves. These are some of the smaller branches that you would go over in a more advanced anatomy class. Now, the lumbosacral plexus of your lower limb includes lumbar and sacral plexuses. Now, because they have significant overlap, we talk about as being the lumbosacral plexus, but we'll also talk about them as being separately. So we'll talk about the lumbar plexus and the sacral plexus. Now, the fibers of the lumbar plexus contribute to sacral plexus through this lumbosacral trunk, and the lumbosacral plexus serves most of your lower limb, but also sends some branches to the abdomen and pelvis. Now, lumbar plexus arises from L1 to L4 spinal nerves, and there's really two major branches of lumbar plexus. We actually have the femoral nerve and the obturator nerve. Femoral nerve innervates the muscles of your quadriceps, so think of these as like the extensors of your leg at the knee, as well as the skin of the anterior thigh and medial surface of the leg. Obturator nerve actually goes through the obturator foramen, hence the name, and innervates the adductor muscles of your thigh. These are branches of lumbar plexus, which is what you can see here. So L1 through L4, these have branches which then divide into femoral nerve as well as obturator nerve. Remember, femoral nerve goes to your quadriceps muscles and the skin of your thigh and lateral leg, as well as obturator nerve, which goes to the adductors of your thigh. Now, looking at this in kind of a zoomed out view, we can see lumbar plexus, which actually originates from the posterior abdominal wall. these branches continue down through the abdominal cavity and then exit at some point through either the inguinal ligament or through the obturator foramen here. So you can see femoral nerve, which is a pretty large nerve, and it makes sense because it goes to a lot of muscles here, as well as the skin on your leg. And then the obturator nerve, which actually goes to the adductor muscles of your thigh. Now, femoral nerve comes from L2 to L4 spinal nerves here, and again goes to your quadriceps. Obturator nerve, also L2 to L4, but those goes to the adductor muscles. Now, sacral plexus arises from L4 to S4. Again, there's some overlap with lumbar plexus because of the L4. And sacral plexus goes to the buttock, lower limb, and pelvic structures, as well as the perineum. Now, the sciatic nerve is the major nerve that comes out of sacral plexus. Sciatic nerve is named this because it goes through the greater sciatic notch, and it innervates muscles like your hamstrings and adductor magnus, and most of the muscles of your leg and foot. Now, there's two branches that come off the sciatic nerve. We have tibial and common fibular branches. And again, those come from the sacral plexus, so L4 to S4. And you can see here that there's a convergence of most of these branches that come together to form sciatic nerve, which is a gigantic nerve that exits through the gluteal region of your body. Now, sciatic nerve continues down the leg, where it then eventually branches into the the fibular branch and the tibial branch here. Now, the reason why you want to look at the sciatic nerve from this perspective is you got to be considerate of the fact that sciatic nerve is a large nerve in the gluteal region. If you sit on this too long, this is kind of what causes that tingling sensation in your legs. But it's also important to note the position of the sciatic nerve when you start considering intramuscular gluteal injections. Because if you go to give someone a gluteal injection and you inject right into the sciatic nerve, it's going to be very painful. So they'll train you to aim higher up, kind of more in the iliac region, on the superior gluteal region, rather than going too low and running the risk of puncturing sciatic nerve. Now remember, sciatic nerve has two major branches. You got the tibial and common fibular. The tibial branch basically goes to some of the hamstrings, and it continues down the posterior leg, so it goes to your calf muscles, which are flexors of your foot. Now, the common fibular branch branches laterally and goes to the fibularis muscles, as well as the extensors in the anterior leg, like tibialis anterior and extensor digitorum longus. There are other smaller branches of sacral plexus as well, like the superior and inferior gluteal nerves, and then posterior femoral cutaneous and pudendal nerves. Now, one place in your body where you don't have a nerve plexus is actually the thorax. So the ventral rami between T2 and T12, they only form intercostal nerves. They actually don't interweave to form a plexus. And these basically just go between the ribs, hence the name intercostal. And they supply muscles of your ribs, anterolateral thorax, and the abdominal wall. And they give off cutaneous branches to the skin along the course to create what we call a dermatome. Now, a dermatome is basically an area of skin that's innervated by cutaneous branches of a single spinal nerve. And all spinal nerves except for C1 participate in dermatomes. Now, the extent of spinal cord injury can be ascertained by anesthesia or a loss of sensation in a particular dermatome. Most dermatomes kind of overlap, so destruction of a single spinal nerve will not cause complete numbness. But what this shows is basically a map of the parts of your skin that are innervated by a specific spinal nerve. So you can see here C2 goes to the skin of your upper neck, C3 and C4 also on the neck, and you can see that they actually form these interesting patterns of innervation along skin in different body regions. Now, this is important to note because if someone lacks sensation in most of their lower leg, you're going to suspect that they have probably spinal nerve damage of L5 and S1 because these are the spinal nerves that go to the lower leg. And you can see that it actually forms this nice little map here. Now, innervation of joints is interesting because to remember which nerves serve which synovial joints, we actually have Hiltons Law. Hiltons Law tells us that any nerve serving a muscle that produces a joint movement also goes to the joint and skin over that joint. So if you think about this, how if musculocutaneous nerve goes to biceps brachii, brachialis, and coracobrachialis, that means that the cutaneous branches of musculocutaneous nerve are going to go to the joint capsule of your elbow, as well as the skin overlying that joint, because those muscles are flexors of your forearm at the elbow, And that's one way that we can figure out basically the dermatomal arrangement of spinal nerves.